It's important for us to note that 50% of the time, you're not sure. You can't tell what exactly is the cause of those poor parameters. And then we call it idiopathic factors. That accounts for 50%. So the remaining 50% is what I would mention: lifestyle factors, alcohol, smoking, the use of drugs like cocaine, marijuana. All of these can reduce, can affect the sperm parameters. Okay. Then you also have undescended testes. Now, this particularly will happen in a male child, and that is why every male child that is born, at birth, the pediatric team would examine the child and ensure that the testes are in the scrotum. If the testes are not in the scrotum and it is not detected on time, and the testis does not descend and surgery is not done to correct it, it will affect the capacity of the testes to produce sperm. Why? Because the testes are not meant to be inside the abdomen. They are meant to have descended into the scrotum. So undescended testes would lead to abnormal sperm parameters. Another factor is infection. So if you have infection that affects the testes, cystitis, or is affecting the scrotum, all of those can affect the sperm parameters. Then varicocele, talking about the engorgement of the testes, the veins that supply blood to the testes getting engorged. Now that will affect the sperm parameters. It will lower the count. And how does it do this? It affects the production of sperm, because sperm production is required at a particular temperature, and usually is 1 degree less than the core body temperature. And that is why the testes are not inside the body. It's not in the abdomen, but in the scrotum, because in the scrotum, it is less than the core body temperature, 1 degree centigrade less. So that is the temperature that is required. Anything above that would affect sperm production. Then you have trauma, surgeries. These are all factors that can affect sperm production. And then if a man has to go through chemotherapy and radiotherapy for the treatment of cancer, for example, all of that will affect the sperm parameters. And then, of course, genetic factors. So these are some of the factors that can lead to abnormal sperm parameters. All right. So next, so we'll be talking about the female factors. Okay, we're talking about the female factors. And the female factors, there are essentially about 5 factors that will affect um, infertility, that will cause infertility in the female, which are regarded as female factors. The first is what we call ovulatory factors, meaning that the woman, any factor that causes the woman not to ovulate, not to produce egg, would lead to infertility. And so what we have the commonest factor that leads to anovulation is PCOS, what we call polycystic ovarian disease syndrome. All right, this is a condition that is common, and it can affect a woman's ability to produce eggs. And if that is present, you discover that the woman will have irregular periods. All right, and then the woman will not be ovulating regularly. When you do a scan, you have a typical polycystic ovary picture where you have a lot of follicles in the ovary, but and they are arranged in a particular fashion. All right, so, and then another common feature with patients with PCOS is that they have abnormal hair distributions. Okay, you could have hairs in their chest, in their chin, all right, in the pubic area, on the hair, on their legs. So they have a lot of hairs. So once you see that, it's something you can actually diagnose by just a physical examination before you go ahead to do your ultrasound, or and then you do your hormonal test. So another other factors that can cause anovulations are high prolactin levels and then thyroid disease. These are some common factors. And then you also have uh, hypothalamic hypopituitary disorders, meaning that there is low levels of FSH and LH being produced, all right, and that is as a result of the lack of stimulation from the hypothalamus. So when you have these, you would also have a woman who is not ovulating regularly. So that is the ovulatory factor. Then you also have the tuber factor. Tuber factor means that the tubes are blocked, and this can be as a result of infection, all right, which could have come as a result of PID, pelvic inflammatory disease, as a result of puerperal um, infection after delivery, all right, or post-abortal sepsis after an abortion, because that is also a very something that is common also in our environment. So once you have an infection that is affecting the tubes, then that would cause a tuber factor. Then you have surgeries. Patients who have had any patient who have had surgery, there's always that risk of the surgery affecting the tube because of adhesions that can form. So patients who have had fibroid surgeries, who have had delivery through cesarean sections, or have had other surgeries, all right? Patients who have had an ectopic pregnancy for which the tube was removed, all of these surgeries can all lead to a tuber factor um, cause. Then endometriosis, that is when you have the inner lining of the womb um, outside the normal location. And so with that, you have a lot of adhesions, and then the tubes can be affected. Then very quickly, you have the uterine factors. So adhesions inside the womb, bringing the inside of the womb together, that's what we call synike, can lead to female factor. And you have polyps. If you have a polyp, a growth inside the endometrium, that woman will not get pregnant. Endometritis is infection that is affecting the endometrium or submucous fibroid. These are all factors. These are all uterine factors that would lead to female factor infertility. Then cervical factors, antibodies, stenosis, and infections. These are all cervical factors that can lead to female factor infertility. And then pelvic factors, again, endometriosis and infection will all lead to female factor infertility. All right. So that is the female factor. So once the patient is not able to achieve conception, we'll take the patient through an investigation and a process of investigation to try and find out what actually is causing the infertility, and thereafter we'll go ahead and then we will treat. All right. So another issue that we're going into right now is, and this is also a question that is commonly asked, and that is, I'm above 50 years. What are my chances? Why? Because we're seeing a lot of women who are coming and wanting to get pregnant who are in their advanced age. All right, above 40s, some of them close to 50 and above 50. And then they're asking what are their chances of of getting pregnant, because age is a very important factor when it has to do with fertility, particularly with the woman. Particularly with the woman, because as the woman advances in age, the ability to achieve conception reduces. So our fertility actually drops. And the significant age for a woman is actually 35 years. So once a woman gets to 35 and above, as fertility drops significantly. and so the chance of achieving conception actually reduces. Okay, so for the man, it's not so. For men, there is a reduction, but that is usually when the man is really advanced, 60 years and above. So for the woman, that age is a major factor. So the question is, can a woman who is 50 get pregnant? The straight answer to that question is yes. Yes, she can get pregnant, but there's a big but. The but is that she won't be using her own eggs. She won't be using her own eggs. The question is why? Why? Because at that age, the eggs are almost exhausted, if not completely exhausted. And so she probably will not be menstruating. And when a woman gets into menopause, the implication of that is that the eggs store in her ovaries have been exhausted. And so she's not having any eggs. And if a woman does not have eggs, then there's no way using her own eggs will be possible, because she will not respond. We won't be able to get any eggs. Sometimes we may get one or two, reduced number, but the major challenge will be the quality. And so this is actually the challenge for women who are in their 40s. And that is why a lot of women who are in their 40s will end up not being able to achieve conception using their own eggs, because of the quality of eggs, which is a function of the age of the woman. All right, so what is the option? The viable option to overcome this challenge is to offer the use of the third party, what we call the use of an egg donor. With an egg donor, you literally can reverse and improve significantly the chances of a woman getting pregnant. All right, so a woman who is 50, women who are in their 40s, yes, can get pregnant, have very good chances of achieving conception, but it will have to be with the use of the third party. All right. So it's a program that we offer. I know that there'll be a lot of questions regarding that issue which I just discussed. If you have any questions, please just type and just send to us, and we'll be glad to answer those questions. So another issue that is commonly asked by our clients is, can I access IVF care remotely? All right, can I access IVF care remotely? What that means is that I'm not based in Abuja, because that is where we have our clinic for now. I'm not based in Abuja. Can I access your fertility treatment in your center? And the answer is yes. The logistics is not a challenge per se. Why? Because we have tried to ensure that we create a program that would help patients who are not based in Abuja to access our services and without so much logistic challenges. And the truth is that we have patients from all over the world who come in to access care from our fertility center. All right. So we are able to handle that challenge. All right. And how do we do that? Next slide. The way we do that is that we try to ensure that we reduce your stay in Abuja when you come for your treatment. Typically, the duration of treatment is between 4 to 6 weeks. That is how long it takes for the treatment process when you start off your treatment. So you need to be able to take that amount of time away from work, all right, to be able to go through the IVF treatment. But what we have done is to reduce that long period to um, as short as 10 days, as short as 10 days, in fact, 7 to 10 days. All right, we have been able to do that. But for us to be able to achieve that, we would need the couple to visit twice. That is the most, twice. The first visit is to come in and have your first initial evaluation. You're having your consultation, you're having your examination, and all that, you're having your investigations done, and all that we need to do to ensure that we get you ready for the treatment. Now, how long does this take, that first visit? It takes about 1 to 2 days, really. All right? It takes about 1 to 2 days. Now, once you are able to have that first visit, the second visit where you will have the main treatment can actually be reduced to 1 week to 10 days, max 2 weeks. All right? And if you're not based, of course, you don't have any relations in Abuja, that is not a challenge also because we provide accommodation. Of course, that will be, of course, at a fee. All right? It's also possible for us to do it in such a way that the spouse will visit once rather than twice. Talking about the spouse of the patient, that is the man, the husband, can come once, particularly for men who are very, very busy. It is possible for us to make their visit once. So for a lot of our patients who are not based in the country, who would come in, who will fly in, we try to make it as convenient as possible to ensure that that visit is done once. And with that one visit, they are able to go through their treatment program and then end up with success. All right. So that is how we were able to manage patients who are not based in Abuja, because a lot of patients have always said, "Oh, you are in Abuja. Oh, we cannot make it. The logistics and all of that." All right, and some are, "Oh, where will I stay?" Some will talk about the cost of flight. Yes, we're all aware of all of that. But see, but when you put all of these together, together with the program itself, particularly if you're coming through the foundation, you will realize that you are actually, even with the cost of the transportation, you are getting value for whatever you'll be spending. Okay, and so it's something that I want our clients not to see as an obstacle, but to actually a bank on this job will be also a very important issue, and it has to do with finance. Finance is always an issue that patients talk about. How do I finance my fertility treatment? And I agree that it's a very, very important issue. Why 60 to 70% of infertile couples will require IVF as the first line of treatment? The unfortunate thing is that it's quite expensive. So we know that a lot of couples who would benefit from IVF are not able to afford it. Why? Because it's simply out of their reach. They can't afford it. So financing such a program can be a huge challenge, particularly when our country health insurance does not provide cover for IVF treatment. All right, you have to pay completely out of pocket. None of our health insurance program covers for IVF, so it's a very huge burden financially. So what do we do to try and mitigate this? All right, and what we do is that we have a foundation that patients apply to. They go through the foundation, And coming through the foundation, the rates are, I would say, appreciably affordable. Okay. Although right now, because of the inflation that has taken place, that is still on, some people may not consider that as affordable. About 2 years ago, we started a program. The foundation launched a program, what we call the Be Fruitful Project, and it was a very ambitious program to. Um, it was aimed at reaching out to 10,000 couples with infertility, offering them IVF treatment over a 5-year period. And we started then. The cost we started then was it was great. 500,000 for 2 cycles, and that included the registration and consultation. It included a bit of the investigations. It included medications for patients who were going through IVF treatment using their own eggs. Um, um, yes, it included egg freezing. All right, it included that those 2 cycles. Also, one of the cycles included a frozen embryo transfer. It was great. This was 2 years ago. When we started that program, actually, a lot of people thought it was a scam because they couldn't imagine how a center would be offering to do 2 cycles literally for about 500,000. All right, but people, trusted us, and then they started, and a lot of them benefited. 2 year in February this year, when we celebrated the second year anniversary of the program, we've had more than 250 couples who have been confirmed pregnant, and we also have celebrated the 1 year birthday of the first baby that was born from that program. We already have celebrated the 1 year birthday, and so it's been amazing. Over these 2 years, we've had to review the price of that program. And currently, what we have right now is that 2 cycles go for 800,000, and then you have investigations that are done, which are also, because of that, the cost is reduced. Whether you're doing the basic or the standard, you're having investigations for 100,000, and then for standard for 180. And then, depending on what your treatment program is, there are additional costs that would apply. And that, like I said, depends on what program you are running. Even with this that I've just said, I still consider it a significant, quite, it's the affordability is still there. Because right now, the cost of 1 cycle of IVF is about 1.6 to 1.8 million. And the cost of medications and everything we use for IVF, it just keeps going up. All right. So I would say that the options for financing an IVF treatment, the best option still remains registering and coming through our foundation, the Abebe Art Foundation. By the way, the program is still on. So for as many who will want to take advantage of it, the program is still on. At the end of this presentation, there will be a number that you can call, and then they will help you to be able to start the process. All right. The other program we introduced is what we call the Jojo IVF Savings Scheme. And this we did because a lot of our patients complained that they were not able to save, that they wanted to be able to save towards the program. So we introduced that. So if you don't have the bulk money to pay, all right, you can call, and then you can pay in installments towards the program. And this is very important. Let me just share a bit about this. There are couples who will require IVF as the treatment option to achieving conception. And it's a journey that they must start all right, if they hope to achieve to achieve um, success. Now, whether this journey starts this year or starts next year, the important thing is that the journey would start. So, what we normally encourage our couples to do is to begin to save, particularly for those who cannot just get bulk money and just pay. I know the thing about money. There are many, many things that can be used for. And once money comes, it goes into some unintended purposes. And so that is why, based on the feedback we got from our patients, we set up these savings schemes where you can pay in installments. And once you meet up, all right, your program will start. The other option that we also have available is the collaboration we have with Access Bank. The Abebe Fertility Center has a collaboration with Access Bank, and that collaboration is able to provide funding for IVF treatment, all right, at a very good rate. The interest rate is good. It's not the normal interest rate at which the bank offers loans to other clients. So we have this collaboration. So for clients who have a stable job, either in a government job or they're working with a private firm, all right, so they have a stable job or they have a business they're doing, all right. With this collaboration, you can be able to access funding from the bank, and then we can go ahead and then start off your treatment while you are able to pay. The payment will be made convenient for you. So these are some of the options that we have available. The truth is that I wish we can do something to further reduce the cost at which we are providing this treatment through the foundation. We are hoping that we will have fundings coming, because right now the way the foundation is able to provide these is through the internal sacrifices that are made just to ensure that we increase the affordability of the treatment program. But we're trusting God that we'll be able to have partnership who such that funds will come into the foundation, and then we are able to lower the cost. And if there's any of our viewers right now who's listening to me online who want to be part of this, why not call us and say you want to be part of this project of helping couples who cannot afford IVF to be able to afford it, and then we will tell you how we can do that. All right, with the counterpart fund that would come in, we'll be able to reduce the cost further at what we are providing right now, and I'm sure that a lot of couples will be able to get into the program. All right, so that is the option. That is the finance options that we have available. All right. So just before we end this presentation, I want to talk about the success rate. Next slide, the success rate, because it's a very important issue, because when you're considering a fertility clinic to use for your fertility journey, part of what you want to find out is what is their success rate. All right, what is their success rate? So you see that this report data we have is from our last year's program. In this place, we try to be as transparent as possible. Now, the average success we had last year, 2022, was 47.7%. That was the average success. Now, in some of our programs, like the third-party program, we had a 56% success. And in one of our batch that we ran, we recorded as high as 75% success. All right. Now, if you ask me, I'll say that this is not bad. All right, this is way above the average. Okay, both nationally and internationally. All right, it's not bad. But guess what? We're even striving to make sure we improve even on our current records. And we've started this year. I think our current success rate this year, average success rate, is 48%. All right, and we are hoping by this time last year, our average success rate was about 42, 43%. So you see, we are doing better this year, and we are hoping that by the end of this year, we would have exceeded the rates that we achieved last year by the grace of God. And we are very concerned about the outcome, about the successes, and so we make sure that we provide individualized, personalized care. Okay, we look at individuals, we look at their peculiarities, and we try to fashion programs that best suits them, that best would deliver for us the outcome that we desire. And that is why when we are counseling our patients, we often will tell them that what the option that will give you your best chance of success, that is the option that you should go for. It may not be the most convenient option, but it will be the option that gives you your best chance of success. So we'll discuss all of these options with you, and by the grace of God, we believe that as you embark on this journey, we are sure that very shortly you would have been moved from those groups that are infertile to those that have become fertile. All right. So lastly, how can I start my journey to parenthood? Oh, you want to start your journey, you're getting ready. So how do you start? The first thing is to locate a good fertility clinic. We'll be glad to take you on. We'll be glad to have you as one of our esteemed clients to take you on this journey. And we are assuring you that by the grace of God, you will have a successful journey. Then after you have located a good clinic, you want to make all the necessary inquiries, because it's a journey you need to prepare for. You need to plan. And what are the plans that you need to make? You need to make financial plans, spiritual, psychological plans. You need to get ready. All right. And once you have done that, the next thing to do is to call. But like I said before, we would give you the phone numbers to call, the phone number to call at the end, and then you can also visit the website to get more details. So you call to book an appointment. Now you can have this appointment from any part of the world. We offer online consultations, all right, if you're not based in Abuja. And then from there on, we can now go on to take steps of faith and start this journey. A journey that you don't start, you cannot complete. And so it's very important that for all of our clients, all of our patients, all those who are watching right now or who will watch this video, if there is difficulty with achieving conception, don't wait anymore. Take that first step. Take a step, call, make inquiries, and then take that step. Begin to plan for it. And I can assure you that before long, you would have achieved your heart's desire. All right? And so, next, so you have the websites, and then you have the phone number to call. All right? So you call, and then our team would take you through the process, and then we'll be glad to welcome you into our facility, and then very shortly we'll be saying congratulations. We can take you from the beginning to the end. We offer both fertility care, obstetric and obstetric care and pediatric care. And you join the many hundreds who have now become proud parents. All right, so I encourage us to please visit our website to get more information. And at this time, I'll be glad to take questions. And I'm sure there are questions. All right, thank you for your attention. All right, so we'll go for a very short break. And after that, we'll be back to take your questions. See you in a bit.
Georgia Abebe Art Foundation was set up in 2015 with the birth of our twins, Joshua and Jemima, ending 13 years of barrenness. The foundation was set up to be a support system to couples trying to achieve conception and to provide the necessary support such as spiritual, financial, psychological, and emotional support. Since inception, the foundation has played a key role in the journey to parenthood of hundreds of couples, and many today have received their bundles of joy. Georgia Abebe Art Foundation launched an audacious project to reach 10,000 couples in 5 years with IVF treatment. As we mark our second anniversary, about 5,000 couples have registered. About 2,000 couples have had their fertility consultation with specialists. About 600 couples have gone through the IVF program, with over 260 couples confirmed pregnant, over 250 babies, and many couples on their way to become proud parents. Amongst of which are couples who have waited endlessly for 29 years, but have been blessed with a set of twins, yet another for 32 years, and are now blessed with triplets. We say, to God be all the glory. As we celebrate God in praises and thanksgiving for the amazing act of God in the last 2 years of the fruitful project, we are confident that God is set to do more as He turns many more couples into joyful parents. For these 100 confirmed pregnant, we say thank you, Lord. For these precious couples, we say a big thank you, Lord. For the targeted 600 couples that will be confirmed pregnant this year, we say a very big thank you, Lord. For the hundreds and thousands of babies that will be born to couples waiting in line for their bundles of joy, we say a million times, thank you, Lord. Genesis chapter 1 verse 28 shall be fulfilled in grand style. To God